Hi, good evening, everyone. My name is Deirdre Walker, and this is my speech for Communications 100. This evening, I will be speaking on poverty in America and its effects that it does have on children and families. Poverty in America is not a unique condition. Due to greed and unnecessary hoarding of resources, children here in America are going without food. Poverty is placed on a human level, meaning that people are perceived or thought to be in control of their income and the way that you want or choose to live. Poverty is defined as a person's inability or ability to allocate enough resources or income to survive. Communities of color face an overwhelming discrimination when it comes to poverty. Long-term exposure to poverty and its conditions leads to damaging effects on the mind and body, which can include anxiety, stress, or even depression for families that worry about how they are going to put food onto the table, pay rent, or even have adequate health care for their family in times of need, such as now that we are facing a pandemic. Healthcare workers also that work in impoverished areas have a lack of workers that impacts their professionalism and also the quality and amount of care that they can provide to patients. It is more likely for mistakes to be made when trying to juggle the heavy workload with being understaffed of these patients. We are experiencing and seeing many of these issues come to light during this pandemic. The largest cases of COVID-19 are affecting the African American community. Low medical supplies and not enough care leads many of these Americans to die alone. We are seeing the crisis of how poverty and those that have been impoverished are being very severely affected by losing jobs and incomes right now. We are seeing this more in the areas that are not able to produce as much income or with jobs that are underpaying, such as grocery store workers, fast food workers, and they're forced to be on the line to work without proper PPE, protective equipment for these hospital workers. They're forced to go in here and care for many of these patients that have the disease, forced to which is forcing them to be susceptible to catching these diseases and carrying it home to their families, which is not fair to these employees nor the families that have to suffer and be alone during this trying time. Also, we are seeing that free lunches are being offered to ensure that none of these children are being left without any meals during the time that they are not in school, where they depend on these meals to eat several times a day. We must use this time to brainstorm ideas and implement actions that can lead to more proactive solutions to crush poverty at the root. I believe right now the government is trying to do this by offering supplemental income to those that are impacted severely right now in order to possibly get them ahead or to get them stable enough to sustain after this pandemic lifts. By taking the time to invest in the infrastructure of social welfare, we can turn our community goals around to ensure that no one has to live in poverty conditions after this and beyond many years. Poverty is something that has been going on for centuries, and it is not a situation that has been handled or resolved fully. You would think now with all the trial and error and all the new developments that have been coming to light and invented, that we would be ahead and that most people would be able to succeed and flourish in our economy. I do live in California, where it's very pricey for rent and also groceries, and it is hard. It is very hard if you were already low income or did not have enough money to survive. I am thankful that I am blessed enough to not be in that position, but there are many families and friends that I do know that I have helped out or donated supplies or meals to ensure that they are taken care of during this time. Poverty is something that America struggles with. Other countries you see do help their residents with free rent, or offering all of these tax breaks or universal health care to each one in their state, in their country. But America, being more liberal wants everyone to basically pay and carry their own part, which is not always a realistic expectation or actually an ability for everyone to accomplish, being that they may not have the education skills or may not come from a financial background to enable them to get to the point to where everyone feels you should be to live in this society. We have to be compassionate. We have to help where needed. And we also have to help also figure out how can everyone live equally instead of the wealthy and the poor. No one chooses to be poor. No one chooses to live in poverty and not have. I, as a single mom, have been there before, and I never want to go back to where I'm not able to provide or able to get good health care because I don't have a PPO or a great medical plan that I'm paying into. I believe that everyone should have a fair chance at healthcare and be able to live healthy, great lives, and to flourish, and also be given adequate skills and tools to succeed here in America, which I do appreciate certain governors pushing for free college tuition within certain states. I hope that most states or all states will adapt this policy to ensure that each and every American does have a fair right and opportunity to wealth. I hope that everyone has enjoyed my speech. Sorry if I was over the place, but I'm not good at doing these little videos. Everyone stay safe during this pandemic, and God bless.